The Arkansas Department of Human Services touches the lives of Arkansans of all walks and stages of life. From our headquarters complex in downtown Little Rock to our 86 county offices in small towns, bigger cities, and rural areas, we serve every corner of the state with the help and dedication of our amazing employees. Over the last year, our employees and leadership team have helped design and implement changes that will serve as the agency's blueprint for the future.
I don't think any of us could have imagined a year ago all the things that would happen over the course of the last 12 months.
As we enter 2018, we look back at our successes and prepare for the work ahead, building off a foundation of service, efficiency, integrity, and innovation from 2017.
It has been amazing to watch this team and all the people that work at DHS come together to face obstacle after obstacle, take on such huge projects, and make it all happen.
Well, I can't tell you what a happy day it was whenever Director Gillespie and Director Stone came to see me and said, "We've got an idea."
With the help and hard work of Governor Asa Hutchinson and state lawmakers, DHS is expanding access to services to 500 families who have a loved one with a developmental or intellectual disability. The lawmakers approved redirecting $8 million in tobacco settlement funds from a discontinued program to expand services to help those people with disabilities remain independent in their communities. Reagan Reeves had been on a waiting list for these additional services for more than 8 years.
I did a happy dance when I opened that letter, and I think they could hear me shouting in Little Rock. I was so excited. But if she ever wants to move out and get her own apartment and live her own life, waiver is a way for her to do that in the future, because they are going to teach her the life skills that she needs.
Last year, the Division of Youth Services unexpectedly assumed day-to-day management of 7 of the state's 8 juvenile treatment centers and began looking for ways to strengthen services. One area of focus for DYS became new ways to engage families in a youth's treatment, which results in new quarterly family days at the centers.
What I hope to get from the kids' perspective is a reminder that DYS is not their last stop. They have families that care about them, that are willing to support them and want to see them succeed in life, which is also what our goals are, that they each contribute towards nudging that young man or that young lady along to being participative in his or her treatment, so that they can come home and be able to do these things with their families on a daily basis, not just once a quarter.
Research shows that family engagement is important for a child's success, especially when families are actively involved in a child's education.
We are high-fiving dads. We want to promote positive behaviors in the classroom.
The Division of Child Care and Early Childhood Education decided it was important to role model the behavior it hoped to see from moms and dads.
We want the students to have higher self-esteem. We want them to do good in school. We want to have higher test scores. We want dads to be actively engaged and involved in their child's education.
Have a good first day. Have a good first day at school. Appreciate you, Dad. Appreciate you.
In 2017, Director Gillespie was joined by the Governor and First Lady in launching Volunteer AR, a new online tool created to connect citizens statewide with volunteer opportunities and nonprofit organizations working to improve the lives of Arkansans. To ensure the long-term sustainability of DHS programs, we continually look for ways to be more efficient. In 2017, our efficiency efforts focused in large part on Arkansas Medicaid and the programs it funds. DHS established a new division of provider services and quality assurance with the goal of strengthening and streamlining Medicaid provider oversight, increasing accountability, and enhancing our relationship with providers. We replaced Medicaid's 30-year-old IT management system. The new system moves Medicaid's core infrastructure into 21st century technology. We also found ways to decrease prescription drug costs for the Medicaid program by implementing changes that saved or helped the agency avoid about $100 million in costs. Having more efficient programs does not mean that our work is done. Program integrity is also important because taxpayers and beneficiaries must have faith in our management of programs.
But she brought me such great news. I said, I'm sorry, I want to talk about this myself.
Last year, DHS's Division of County Operation made great strides in improving the accuracy of Medicaid rolls.
Today, there are 117,000 fewer people on Medicaid than there were a year ago. That is a 10% drop in Medicaid enrollment during the last year.
DHS also strengthened the integrity of food programs that serve youth through improved monitoring and more extensive checks and balances on food sponsors so that programs are strong and available for children who need them.
You know, when you're not in school anymore, that takes away at least 2 meals a day. So some kids could be dropped down to only having 1 meal a day, if that. I love being able to do this a lot. We know they're gonna have a full belly.
More efficient programs built with integrity are critical, but state agencies must also innovate. Arkansas made headlines last year with its efforts to create a new way to better serve certain individuals with complex health needs. The new approach will give these individuals a provider to coordinate their care so that they stay healthier and have fewer costly hospital stays. The agency also, for the first time, connected Arkansas Works enrollees to tools that will help them find work or better jobs. Because we know that people with developmental disabilities also want to work and be a part of their communities, DHS secured an AmeriCorps grant that allowed AmeriCorps volunteers to build community gardens at all of our human development centers.
So we've traveled to all 5 HDCs in Arkansas, doing gardens at each of them, and it was really special because each HDC got to design their own garden. So they're all a little different and unique to the specific client population that they're serving, but their main goal was to employ the clients and give them a little income and also some socialization and to integrate them in the community a bit more.
I think it's going to give clients a really good opportunity to interact with the community that comes in. So I know it gives them a good opportunity to learn and to provide for themselves, which is really important.